This video demonstrates posterolateral intra-extra articular Tenodesis technique or plate technique, which is a novel technique for lateral tenodesis of the knee. The patient is lying supine. The site of the skin incision is located by palpating the skin on the lateral side of the femoral condyle, where the skin is illuminated by the light from the arthroscope. The popliteus tendon insertion is identified arthroscopically at the lateral condyle of the femur. After the location is identified, an 18-gauge needle is used to mark the location for the tunnel of the graft. The needle is pointed towards the anterior aspect of the popliteus tendon and lies adjacent to the tendon. Next, the incision is then made about 3 centimeters from superior to inferior, parallel to the iliotibial band. Next, a guide pin is inserted at the marked location, from the lateral side to the superomedial side of the knee. A 6 mm reamer is used to create a tunnel of 3 centimeters depth. Then, a suture is passed by using the end of the guide pin, leaving the loop side laterally for passing the graft at later steps. After completion of the femoral tunnel, the iliotibial band is identified by retracting the subcutaneous tissue. Distally, the proximal fibula is then identified, and a 4 cm vertical incision is made above the head of the fibula. By meticulously removing the surrounding soft tissue, ensuring not to injure the common peroneal nerve, removal of some muscle attached to the bone using a periosteal elevator is done. Then, a 4.5 mm drill is used for creating a tunnel for the fibula. The graft is then placed inside the fibula tunnel with the tunnel at the middle of the graft. The clamp retrieves both ends of the graft to pass through the iliotibial band. Next, both ends of the graft are placed in the loop of the previously prepared suture, which resides in the femoral tunnel. Then, the graft is shuttled into the femoral tunnel, leaving both suture ends of the graft at the medial aspect of the thigh. A guide wire for an interference screw is inserted into the femoral tunnel, adjacent to the graft. The graft is then tightened manually, and insertion of an interference screw with a diameter of 7 mm is inserted with the knee in slight flexion and internal rotation. The skin is then closed in a routine fashion.